Hello, do you have pain in your hands or in your feet? Or do you have tingling and numbness or electric shock like feeling in your hands and in your feet? If you do, you may have this condition called peripheral neuropathy. Now, peripheral neuropathy or nerve pain or tingling or numbness is a common problem, especially as one gets older. The incidence tends to rise as one gets above the age of 50 and is far more common in the ages of 60s, 70s and 80s. Approximately 5 to 10% of the population in this age group will have involvement of the nerves in the hands and feet. Now we have large nerves in the hands and feet. We also have small nerves in the hand and feet. When the large nerves are involved by any disease process, you tend to get more numbness. If the small nerves are involved in the hands and feet, you tend to get more pain, and this pain may be burning or it may be electrical or shock-like in nature. Now, what are the common reasons that you can have nerve pain or tingling and numbness? So the commonest reason is diabetes, and even if you're pre-diabetes, you may also get this nerve pain in the hands and feet. So it may come as a surprise to you that even if your diabetes is mild or if you are in the pre-diabetic stage, you may still experience nerve pain in the hands and feet. So your nerves are very sensitive to changes in blood sugar. And as the diabetes worsens, the nerve pain can also worsen in the hands and feet. If your diabetes is treated too aggressively, that is, there is a too aggressive drop in blood sugar over a rapid period of time, you may get a condition called treatment-induced neuropathy of diabetes. So it's important for you to treat the diabetes but not too aggressively until you get this burning pain in the hands and feet. Now, there are other causes of nerve pain. The other causes being if you have deficiency of vitamin called B12. So B12 deficiency can occur due to an autoimmune process, or it can be due to a dietary deficiency. Now, this dietary deficiency is commoner in vegetarians. Having said that, B12 deficiency is still rare among vegetarians. Copper deficiency can also cause nerve pain or tingling and numbness in the hands and feet. In addition, there are certain disease processes which can cause pain in the hands and feet. These disease processes are actually autoimmune diseases, or what I would call cell against self. So normally your immune system should be attacking foreign invaders like your bacteria and your viruses. But sometimes the immune system goes haywire and your immune system starts attacking your own cells. So this is called an autoimmune disease. So certain autoimmune diseases can present with nerve pain or tingling in the hands and feet. In addition, certain blood malignancies can also present with tingling in the hands and feet or pain in the hands and feet. Now, how is nerve pain investigated? So nerve pain can be investigated by doing nerve tests of the hands and feet. Electricity is applied along the course of the nerves in the hands and feet, and they are compared right and left, both in the hands and feet. And it is possible to look at the size of the nerves, and it's also possible to see how fast the impulse is traveling along the nerves. Now, based on this pattern of the size of the nerve as well as how fast the impulse is traveling, it is possible to further investigate the nerve problems. The other way to diagnose the cause of the nerve pain is by doing blood tests. And these blood tests look for B12 vitamins it looks for diabetes, it looks for copper, and the blood test can also look for these autoimmune diseases that I was talking about, and they can also look for blood malignancies. So it is important to remember that pain in the hands and feet can be a sign of an internal disease, and it should not be brushed off. Of course, in some cases, no cause is found, so then treatment is only given to alleviate the nerve pain. But when a cause is found, treatment is given for that particular cause, as well as treatment is given to alleviate the nerve pain. I hope you've enjoyed this video. Thanks for watching, and I'll see you next time.